nursing fields here with us today. And so in just a few minutes, I'm going to go around and have them introduce themselves to you. They will give you a little bit about their background and what they're hoping to get out of this event today. Not only networking, but some of them will have their own career path to share with you, and others will share with you different employment opportunities that they have currently available and what to expect in the future. So again, thank you for being here. Feel free during it to put your questions in the chat at the very end after the introductions, and then we'll go through very specific questions that we'll have for the panel. At the end, we'll have questions that you can ask the panel. Again, you can put them in the chat room, or you can use the little emoji to raise your hand. And then at the very end, please stay to hear from Joe Riley. And also for those of you that stay, you would be eligible to participate in our raffle. So we have a gift card to Panera Bread, and so please stay to the end, and we'll give you instructions at the end. So let me stop sharing my screen right now. And before we get started, I'm just going to hit continue. If you wouldn't mind, just for those of you that arrived before I have the employers introduce themselves, would you mind just putting in the chat just the curriculum that you're pursuing here at Duchess, so our employers can see who is here with us. So just take a moment if you'd like to share, and just put what degree or certificate that you're pursuing here. Okay. And with that, I would like to introduce our employers. If there's anybody who would like to start, we have Nuvance, Caramount Medical, Emergency One, Ethan Allen Staffing, and we have Mary Ellen Foster from, who is the Director of Surgical Nursing for a major healthcare facility in New Jersey. I hope I did not forget anybody. Would anyone like to start? Maybe somebody from Nuvance?
Sure, Nuvance would be very happy to start. Hi, everyone. Thank you so much for having us attend your event today. My name is Kim Fiakovich. I'm the manager of nurse recruitment for Nuvance Health. I'm here with my colleague, Jessica Tola. Jessica is one of our nurse recruiters, and we have a variety of different opportunities available throughout the many areas in the system. We have over 1,000 open positions right now. I'm so encouraged to see all of these nursing students here today. Primarily, we hire new grads into the hospital areas, but certainly the medical group offices are starting to hire newly graduated nurses. So this is a great opportunity for any variety of nursing that you're looking to pursue. Yep. And I'll kick it over to Jessica just to say hello and share a little bit about the openings as well.
Yes, hi everyone. Thank you so much for joining us today. So we do have openings within RNs, LPNs for our medical practices, primary care and specialty as well. Most of our openings are full-time. We also have part-time positions available. We also have some positions in home care, and those positions are full-time as well.
Thank you.
Thank you.
Anyone would like to go next? Teresa?
Sure. My name is Theresa Lindgren. I'm the Human Resource Coordinator for Emergency One. Emergency One is a privately owned urgent care company. We currently have 4 locations in the Hudson Valley: Kingston, Poughkeepsie, Hyde Park, and New Windsor. And we're growing, and soon to be more facilities, which I can't really discuss right now, but we are going to be growing very soon, which is why I thought it would be an appropriate time to join this call. We staff everything from physicians, nurse practitioners, PAs, RNs, LPNs, and medical assistants and radiology technologists in each of our facilities. We are almost always hiring medical assistants and medical assistants. We do really like phlebotomy, people with phlebotomy certifications, which is something that we do really like to bring into our facilities. We train on site for all of our medical assistants. So in the near future, we're probably going to be looking to hire medical assistants and LPNs.
Great. Okay, great. Anyone else? Rebecca, would you like to?
Of course. Hi, everybody. Happy to be here. My name is Rebecca Shore. I'm the Talent Acquisition Manager at Caremount Medical. Caremount Medical and Caremount Health Solutions, our parent company, have been around since 1946. We have over 45 locations. We service, close to 700,000 patients annually with 50 different specialties. We are always hiring for clinical and non-clinical, so medical assistants, LPNs, RNs, phlebotomists. We have an in-house lab that's located in Brewster, New York. So specimen processors, phlebotomy, clinical lab technicians, and some of those further trained lab positions, grossing techs, histotechs, cytotechs, and yeah, exciting time for all of you guys. Nice to meet you all.
Tara, would you like to go next?
Yes, hi. Thanks for having me today. My name is Tara DeFries. I'm from Ethan Allen Staffing. We are a full recruitment firm. We do temp and temp to hire. We have actually 3 different divisions. We have an administrative division, an industrial division, and medical. I specialize in medical. We have 4 offices in the Hudson Valley. We have a Poughkeepsie office, a Fishkill office, Middletown, and Kingston. We're always hiring, looking for nurses. We have medical assistant positions, medical reception positions, RNs, LPNs. I hire new grads. You could work temp to hire, part-time, per diem. So we have a lot of different types of opportunities. You can go to our website. It's eaworkforce.com and click on a job seeker and upload your resume.
Thank you. Mary Ellen?
Yes, hi, everybody. My name is Mary Ellen Foster. I am the Director of Medical Surgical Nursing at a hospital facility in New Jersey. I have 5 med-surg units and about 150 employees, nurses, nursing assistants, unit secretaries. I've been a nurse for 36 years and I've done it all. So if you have any questions for me, I'm happy to help you out. I'm so happy to see there's so many nurses in the chat. That's great. Nursing students, soon to be nurses.
Thank you. I think, did all the employers? I think all the employers introduced themselves. Did I miss anybody? I think so. Well, again, thank you. We're very, very excited and grateful for you to spend your evening with us and share with our students. And at the end, we will give an opportunity for you to put your contact information or at any point in the chat room as well, whether it's your personal contact information or your organization's contact information, so that whatever you'd like to share with the students. So with that, I'd like to turn it over to my colleague, Michael Strachey, and he's going to facilitate some questions regarding the environment, regarding employment, and I'd like to turn it over to Michael.
Thanks, Melissa. Hi, everybody. Welcome for the students who joined a little bit late. Thanks for coming tonight. And thank you again for employers for being here. The first kind of section that we had thought about in terms of questions and really trying to get an understanding from employers was COVID and how that's been something that's really been prevalent for everybody, no matter what field. It's really affected everybody. And it continues to be prevalent, unfortunately, even into the new year. So just to get started, just basically we wanted to just ask employers to maybe reflect a little bit about how has COVID affected your company or your position. What have you or your company done to adapt to the new circumstances that we face now under COVID restrictions and everything that goes along with that? And what safety precautions is your company taking? And how has your typical day changed? I think that was kind of the first thing that came to our mind when thinking of questions to ask you all. So would anybody like to just maybe remark on those areas that I mentioned? And feel free to jump in.
Well, I could start.
Thanks.
it's changed the landscape of healthcare immensely. I know when, and I'm on the front line, I'm a director, but I was in scrubs and I'm with my staff and I go and I help, and I just feel like I have to be there and help them. We were hit with this tsunami and we had to just bob and weave and figure it out as we went. And I think now we have a handle on it. Thankfully, a year later, we know the strategies that we can put into place, the modalities of treating the patients so they're not getting to the point of the respirators and the ventilators and unfortunately dying. And the infection control processes that we didn't really know. We didn't know what we didn't know. And I think it was a collaborative effort throughout the whole institution. And but it really has changed the landscape. I think it's here to stay. And I think a lot of people need to really evaluate, COVID and think about it as you're going into the healthcare field, because it's not going away. You can't choose your patients. You can't choose who you're taking care of and where you can choose where you're working, but your patients are your patients. And I think at this point now we're hopefully heading down, and I hope that we continue on that path. But it has caused a lot of fragility in the staff and nursing and me, myself. And I think you all have to be supportive to each other and be open with communication and how you feel about it. Cause it has, nurses have left, nurses are just leaving after. So it's been a challenge, but anyway. That's my 2 cents on COVID.
Thank you. No, I mean, it's good to hear from someone who like like yourself, who's on the front line, and especially for students, just getting into it. I'm sure none of you expected this to come down the line, but I've heard from other folks that you had, like you said, bob and weave.
Yeah.
Would any of the other employers care to share, like in their area, how it's how it's come to affect your hiring and what you've seen in your job day to day?
For us, our situation has been, it feels like we've been on a roller coaster. We closed down for a little. We didn't close down. We didn't see as many patients. When New York State shut down, it really slowed down. And then all of a sudden, people started coming in for COVID testing, and we couldn't keep up with the volume. We just couldn't. We actually went to Ethan Allen and had them help us out with some temps for a while, which thank goodness you guys helped us, because I was ready to jump. It was just crazy. But now I think everything now is starting to settle down. We've all had the vaccine. Everybody just feels a little bit more normal, here anyway. I know in the hospitals it's probably a little bit different.
Yeah.
Certainly. Yeah. One thing I forgot to mention, just as a housekeeping thing, if you remember and you're responding to a question, if you could just let folks know, just as a reminder, where you're what your company is or where you're working, and for anybody who might come in late.
Mm-hmm.
The other part about our COVID questions was just, it sort of has been touched on a little bit, but I was just curious to see if anybody else has anything to share about what their company's plan is to persist through this time, because obviously, like we've mentioned, it's not going to go anywhere. It's not going to go just flat away anytime soon. What does the outlook look like for new nursing students or nursing students just coming out of their schooling? Would you say it's a bright outlook right now because in terms of getting a job? What's your opinion on that?
I would say yes. Yeah, there's opportunities, because like I said before, people have hit their limit. Like nurses that have been in it a long time, they're just like, you know what, I'm done. I'm finished with my career and I'm leaving. So I know from me myself, I have plenty of and people leave all the time. They just decide a different avenue, different road, and I'm in the med surg arena, and it's to be expected. People want to change, go to ICU, go to ER, go to an outpatient setting, and so I'm always looking for opportunities, new hires, and I think you'll always get a job in nursing.
Yeah. Well,
I feel the same way with you, Vince.
Yeah, for sure.
The same thing with us. We have been have openings nonstop. We're a growing organization. We have many practices. We're acquiring more practices, the same as our hospitals. So we definitely have opportunities available for new nurses and experienced nurses as well.
and that's a really good transition just to talk a little bit about our next section that deals with just educating students about the various positions and requirements needed in their desired career field. So I was wondering if I could focus in just for a minute on the different hiring agencies we have here, both for Emergency One, New Vance Health, Caremount, Ethan Allen. What types of jobs or internship opportunities do you have offered right now? What full-time jobs or entry-level positions are there? And what kind of experience would you generally say is required for entry-level position when you're hiring folks? Anybody care to share on that?
I'm happy to speak for Caremount. We're always looking for new hires, and I think it's going to depend on what capacity, right? So yes, new nurses. We have some specialties that are very able to support and mentor those new nurses, and then others that are a little bit more intense and not the most conducive environment to a new nurse. But we also have a really robust transfer program. I think, like Ms. Foster was mentioning, people that want to switch their specialties, and after getting your experience maybe in a more generalized internal medicine or family medicine specialty, then have the knowledge of the organization to take with you to another specialty. And then for non-clinical, we have front desk, we have a contact center, we have schedulers. Those are all really great entry-level opportunities, and we just really look for a strong customer service. Obviously, healthcare or medical knowledge is always welcome, but we regularly hire people with just very strong customer service backgrounds and not necessarily the healthcare.
Great. No, thank you.
Same with Ethan Allen staffing. We have lots of opportunities right now. We have a lot of employers right now looking for candidates, MAs, medical receptionists. So if you're a nursing student, haven't graduated yet, and you want to get a job working as a medical assistant and get your foot in the door, it's a good opportunity for you to kind of streamline that way. And with nurses, LPNs and RNs, I have lots of new opportunities for nursing home. So if you want to get your skills, that's a good place to start. We do have front door screeners. That's a new position, hence COVID. So we do hire front door screeners. This way you're working in a medical office environment, you're getting adapted to that environment, and then can move from there.
Yes, and we like to hire students as well for medical assistants. It's a great starting point if you're going to go into a nursing career. We do the same thing. We look for those people.
Yeah.
You do really well. They want, students want to learn, and then there may be opportunities for full-time positions as LPNs once you're done graduating as well.
Would you say there's any specific qualities when you're looking at new candidates that you're hoping that they have in terms of their work ethic and stuff like that? Any comments about that?
I think empathy is a really important skill set that I think we would all agree upon. Recognizing what it is that we're here for, and whether that is a clinical role like we're referencing, or even back-end support like IT or payroll or human resources. We're all here to support our communities and making sure that our physician offices are supporting our patients in the best ways possible.
Sure.
I just wanted to add, a student asked if your companies are hiring or giving internships for healthcare management graduates.
sorry, for healthcare what? Healthcare,
for healthcare management.
healthcare management?
Are there any opportunities like internships you could see them doing at your places of work?
Paramount doesn't currently have an internship program. It's something that, you know, we revisit regularly, but we just haven't been able to figure out a safe way to implement an internship program.
Another question was, do you feel that full-time nursing candidates are more desirable than per diem? Good question.
I'll take this one. If you're a new grad, you need to seriously consider a full-time position. You know, the expectation of a per diem position is that you know what you're doing and you're coming in, you just get a lay of the land and the computer system and you can hit the ground running. So if you're a new grad, I would not even consider you for a per diem position. You need to go in, guns blazing, you did your degree, you took your test, now head your career full-time and go for it.
Thank you. Ben, did you want to share? I think we have one more question now.
Yeah. Is New Vance holding a bridge to practice program for new grad RNs?
Hi there, this is Kim Fiakovich from New Vance Health. I'd be happy to take this one. And thank you, Charity, for your question. We are hiring in
the latest U.S. Census data from 2019.
I don't think that's me.
No, I'm sorry. Can you mute your, I think it's Kelly. Could you mute your, thank you. Sorry, Kim, go ahead.
No worries. So we will be hosting a residency program for newly graduated RNs. We are in the planning phases with that right now at the different hospital locations. Typically, we have them 3 or 4 times a year starting in May. So if you visit our careers page, we will have everything posted there soon. We are in the planning phases with the hospital CNOs. Volumes have changed significantly due to COVID. So we are resourcing some of our nurses and moving things around to accommodate the shifting volumes. And in that, of course, determining where the new grads will be best served. So that work's happening now. I would just suggest that for all of the new grads that we expect for the May dates, you can go ahead and start applying for positions that you see now, and our recruiters will know what to do with your applications as far as keeping track of it for those programs. So certainly don't delay in applying. We just haven't posted the positions yet.
Thank you. We have one more question, and I'm going to just put out there. Do you have any positions for PCT?
Or CNA, I believe it says. So for
Or
CNAs.
Ethan Allen has a lot of needs for CNAs. So if you are a CNA, I absolutely could hire you.
We do too for
Yeah.
our practice as well. Yeah.
Thank you all for answering. The next thing I'd like to do is just turn back to the students for a second and ask a question. You can use the chat box to respond or submit your response. Our question is just, are you planning to go directly into the workforce in the next 3 months? Just curious in terms of timeline and I guess maybe like the sense of urgency, right? You know, you're looking for a position and it's now, it's not, 2 years down the road. We got one yes. That person's definitely on it.
Oh, a lot of yeses. Yes. So employers, we were talking prior to the students coming in, for those of you that said you have a lot of opportunities, you could see by the chat that we have a lot of ready and able students for you here. I think there was a question that
You skipped?
came, no, it came, I think, before the students were mentioning that some thought they had to wait to take the NCLEX before applying. And with COVID, I guess there was concerns about taking longer to take the exam. Did anyone want to clarify?
Yeah, sure. I can take that. This is Kim Fiakovich. So you do not have to wait to take the NCLEX in order to apply. different hospitals within New Vance have a different standard for the way that we apply the rule. For instance, in Danbury Hospital, you can start while your NCLEX is pending, but at Vassar, that leadership has decided that they want you to have passed your test before your start date. So that is different at certain locations, but please don't hesitate to apply. You don't have to be licensed in order to apply.
Great.
Thank you. Thank
You're
you.
welcome.
Well, thank you to the students for, letting us know a little bit about their, peek into their life. Moving along, the next section we wanted to touch on with employers was dealing with educating students about their career journey. And I know that, Mary Ellen, you're directly right in the field. But I think this could be, pretty relevant to other folks as well if they know of experiences of other employees perhaps that they've seen go through their office or that they've hired. So there's some of the questions that we had just thought to ask you all was, what motivates you to do well and keep going? What are some of the major challenges that you've all seen, you've all faced, especially with, with the last year coming about down on us? And then just thinking about where did you start and where you are now, if you wanted to reflect on that. Anybody care to take that one? Let's see. What was Mary Ellen, would you mind sharing what was your education experience like?
Sorry,
I don't mean
I
to-
was on mute. Yes, I
Oh,
was
yeah,
on mute.
okay.
Yeah, I mean, like I said before, I've been a nurse for a long time, and I started off with a bachelor's degree, and I went right into the critical care unit, and I started working. I did traveling nurses, and then I went to the ER, and so I did a lot. Then I settled down, got married, and I started to do per diem nursing because I was focusing more on the family. And then once my kids got a little bit older, I went back to work, and I had the opportunity to get my master's degree in healthcare management, and it was half price credits. It was subsidized by the hospital. The classes were at the hospital, and it was just too good of an opportunity to pass by. So I pursued my master's in healthcare management. And while I was doing that, I said to one of the leadership team, I was like, I don't know if this is really for me. I don't know if I want to be a manager, and she suggested that I become a supervisor, and I took that and ran with it, and I absolutely loved it because I was able to put fires out and just help the staff be side by side with the nurses, and I just absolutely loved it. And then it just snowballed into being a manager and now a director. And that's it, 36 years, there you go. It's just so many opportunities, and I love nursing. I love my nurses. I think of them as the younger ones more so as my daughters, and
That's amazing.
it's been great.
Yeah. No, thank you.
Yeah.
Do any of the other folks maybe perhaps know of somebody that's some kind of similar experience, or even say talking about how you've seen things transition throughout your time working in either hiring, HR, that kind of thing? Anybody else want to elaborate maybe on that? I'm trying to think how it could be like relevant for folks who may not be on the ground floor kind of thing.
I can say at Caremount, maybe a little bit similar to Mary Ellen, is that our patient care managers and our regional directors of clinical operations regularly started as a staff nurse, and they were able to work themselves up and progress towards those management positions if interested. And some of them have been with the company for 20 plus years, which is great.
Wow.
I'll jump in too.
Yeah, thank you.
Ethan Allen, I've been working with Ethan Allen for 15 years, and I've hired a lot of entry level, candidates over my time, and now they've become my clients. They've moved up the ladder, and now they're working as administrators and RN managers and unit managers. So that's nice to be part of that.
Yeah, it's nice, I'm sure, to see that progression over time. We had just in the meantime, we had a couple of other questions that came in. One student wanted to know, does the same apply for ASCP certification and New York State licensure for MLTs? Anybody have a specific answer for that? Otherwise, I can move on if we're not sure.
Does the same apply in what respect? I'm sorry.
I'm trying to see.
I think this is related to that question about the NCLEX. So but this is for MLTs. So do they need to, if you, Gian, if you want to elaborate, but is that what you mean? That do they need to have the certification and New York State licensure for MLTs before applying? Is that what you're
and feel
asking?
free to feel
Yeah,
free to
yes.
unmute yourself. Yeah, I apologize about that, Rebecca. I read that question without the pre.
No, that's
pre-check.
okay. Again, we do hire medical lab techs, and I would say that we certainly wouldn't delay until you get your licensure. I would engage in that application and that interviewing process, and then, you know, discussing that timeline of getting your license throughout that process.
Thank you.
Thank you.
Let's see what else.
We also had another question.
Go ahead.
So can you talk about the reality of hiring ADNs versus BSNs and whether being enrolled in a BSN program helps our applications?
Yeah, I'm happy to take that one to provide the hospital perspective for New Vance Health. So the world pre-COVID, I think always and almost to exclusion in certain locations would prefer the BSN to the associate's degree in nursing. And we encourage you to, of course, pursue your education moving forward. However, since COVID has happened, I really think that's shown the value of every level of education within nursing, that when you come out, if you are eligible for the license, that there is a valuable skill and an important place that you belong in the marketplace. So if COVID has shined a light on anything, I think that is one of those things. So again, that's why we do encourage you to apply. It may be that a hospital CNO will say, okay, for this group, I need BSN prepared, but another hospital CNO the same year could say, yeah, show me everybody. I want the best candidate, someone with the best heart for nursing. So they will interview, you know, regardless of what that degree is. So every pot has a lid, as we like to say. So I hope that answers your question.
And I think too, there's certain hospitals that are magnet status and they are going to require only BSNs to apply. And then there's other hospitals, like our hospital is, we don't do research, so we're not as big as some of the academic centers. So we are the Pathway Hospital, which is just down from magnet status. But, you know, we're going to hire associate degree nurses, and to have you being enrolled in a BSN program, to me, I'm going to look at the person. You know, that's not going to be a tipping factor to me, but I definitely support my nurses going back for the bachelor's degree. And I think sometimes if you could take advantage of tuition reimbursement at your hospital or your facility, you know, I took advantage of it, and I encourage all of my staff to take advantage of it. And it's a great opportunity.
To follow up on that question, they asked, does having ACLS and PALS also include an application? No.
You know what? If you're a new grad, you could take ACLS and PALS. You're not even going to understand it. So you're not even going to understand it. I'm telling you right now. So it's not going to be an advantage.
Well, you heard it there, folks. No.
I'm sorry, it's not.
No, it's the honesty is appreciated. I think students definitely want that, you know, realistic view.
Right.
Go ahead.
It's advanced cardiac life support and pediatric advanced life support. You know, you really got to get into nursing and you don't know what you don't know, and you've got to get into the field and learn, and before you can deal with complex cardiac issues. And if there's a code, you're not going to be the person running it.
Mm-hmm.
I'm going to be the person running it. You know what I mean? So.
Let's see. Was there any other, I'm sorry, go ahead.
I was going to say there's a question here about a lot of the students living locally in the Poughkeepsie area to the New Vance hospitals here and would like to work locally. Are they hiring? Are you hiring locally, or do they need to think about going down to Westchester? I think that may have been answered, but I know it's directed to New Vance, but if anybody else wants to answer here too, Caramount, Emergency One, Ethan Allen, can you just maybe respond to about local to the Poughkeepsie area?
We have several locations in Poughkeepsie, Fishkill, Kingston, not too far from Poughkeepsie. We've got lots of local opportunities.
Certainly the same with New Vance Health, particularly, especially, obviously Vassar, but the outpatient locations as well. We have primary and specialty care areas, and an RN with an associate's degree is a very popular candidate for those areas. So please apply if you see something geographically that's interesting to you. We would love to accommodate someone in our own community. So.
Thank you. Was there anybody else? I don't want to cut them off.
We also have one more student question. Does anyone offer tuition reimbursement?
We do.
We do as well.
Typically, you have to work for a year before you're eligible in most places that I've worked, but I don't know if you guys can speak to that for your organizations.
We have a 6-month eligibility, maybe not as robust as a reimbursement plan as one of the hospital systems, but we have a 6-month eligibility.
That's great. Yeah, I've talked to a few students actually doing work with the certified nursing, and they've all told me, my job's paying for it. So that's good. Just to ask one last question for students, if you want to submit in the chat box, how prepared do you feel to enter the workforce? And I'm sure maybe you use an emoji for that one, the reactions, but maybe like a word or two of how prepared you feel. I'm going to save this question too. Employers, any direct affiliations with certain schools like Chamberlain or Excelsior? Was there any of those, any of you folks know of any affiliations with those schools?
And
In
maybe
what regard?
What's that?
An affiliation in what regard? I'm sorry.
I'm not exactly sure. Charity, if you wanted to elaborate on your question, we'd love to hear what you have to ask.
It was just in regards to like for the bachelor's degree, because a lot of us are ADN. So in going further, Chamberlain has been reaching out, I'm sure, to all of us, and Excelsior and all the other online programs. And I know some hospitals and organizations have affiliations. So I was just wondering if anyone here had that.
Okay, that's a good question.
In part of your interviewing process for where you're going, you need to find out if your hospital does have an affiliation. I know we have affiliations with many Chamberlain and a couple others. So that should be part of your interview process, sure, because that's a great opportunity. That's how I got my master's degree. So.
Oh, thank you. Somebody else wants to know also, when would be the best time to apply? And I'm assuming they mean a job in the field if I'm graduating in May.
Start now.
Apply now, right?
Yeah, I was gonna say probably good time. Well, we have like a question and answer portion laid out at the end of this. But I mean, a lot of folks have asked their questions already, so we'll definitely give that opportunity still for the students that are present. If you have another question, this would be the opportunity to send it in the chat box. We'll get it out before the end of the event. But our last section is just talking about creating a networking opportunity for employers and for students. If you want to share your contact information, you could share the best way to contact you in the chat box, Just so everybody knows, we'll be keeping a copy of the transcript for the chat box. We also have obviously everybody's contact information, so we'd be happy to share it with anybody who may not, pick it up. If employers just wanted to share, what's the best way to find out about updates or opportunities from your company or agency? And then any parting, any last words of advice that you'd have for these students would be really appreciated.
So I think the best advice that we can give for the students, of course, is to always put your best foot forward in the interview process and your first engagement with the employer that you're applying for. And by that, what I mean is make sure that your application is free of errors, that your email addresses are appropriate and professional, that you have an updated resume. If you have an NCLEX test date, put that on the resume right up front so that we can see it. And just make sure that every interaction with the recruiters, with the hiring managers that you'll meet with, and that every touch point throughout the process that you're professional and responsive in the process. And that's sets the impression from the beginning that you're serious about the position and professional, and it makes a good rapport. So definitely a great takeaway for you guys.
Excellent advice.
Thank you.
Thank you.
Anybody else like to share?
On time for your interviews.
Be on time, is that what you said?
On time for your interviews. Yep.
Absolutely. If you're early, you're on time.
Professionally. Yep, and dress professionally. That makes a big impression.
And on that note of timeliness, I will say, I know Caramount Medical and many other organizations are conducting our interviews virtually right now. And so I think understanding the technology that your interview is going to be taking place on, whatever platform, make sure you download it in advance, test it out either with somebody within the company. I know my team's always happy to do a trial run in advance, or have a friend or family member test it out with you. And try not to have a dog running around in the background that is mad that you were at work all day and now I'm not playing with him. So I apologize.
That's a great point. I was going to say, actually, if anybody's interested, we've put together, the ACT Center put together a nice list of things to consider for Zoom meetings, in particular. So if anybody would be interested in seeing that, we'd be happy to send that to you as well. Did anybody else want to touch on last advice or best ways to check for updates in their company, that kind of thing?
I would say a good resume. Also, do your spell check. A good resume it's very important.
Absolutely. Yeah, and I mean it's so easy too. A lot of computers, I mean, they just have the formats for you already. So that's what I've always used. I would suggest folks use that.
Share your resume with some of the people in this department. Just have them proofread it. I mean, just don't go. Take advantage of the people that are around you that have been through it, because I won't look at a resume if it says spelling wrong, or if the format's bad. Just won't look at it.
That's good to know. Yeah.
That's excellent.
We do have one more student question, but I wanted to make sure that everyone that wanted to answer that question got a chance. So was there any more employers that didn't answer the previous question, or?
I agree with everything that everyone else said. Resume is very important, for sure.
So the last student question is from Victoria. She's seen a lot of phlebotomy jobs asking for at least a year of experience. Do you still hire fresh out of school?
I'm happy to speak for Caramount. We're always hiring for phlebotomists. And sometimes maybe less important is that year of experience, but for a newer grad, maybe how many sticks they've done. If they can quantify that or maybe take some extra training while they're in their program and make note to quantify that, I think that's going to be really helpful for a new graduate.
Thank you.
And that's obviously not the right terminology. You can tell I'm not clinical. Distracted, sorry.
You don't know what that means though.
blood draws, pardon. Yeah, my brain's coming back to me.
Well, I think this is your last chance for the students if you have any additional questions for our employers. And we think this is a great segue into, and please, students, please stay. I think it's a great segue into, we have Joe Riley here from Careers, who's going to just talk in a few minutes about a lot of your questions or answer a lot of your questions here about preparing for interviews and the cover letter resume. I see that coming through the chat now. So please put that in. Employers, we want to say thank you for being here this week. We can't thank you enough for being here and spending again your evening with our students. This is I hope the students can agree, and if feel free to put it in the chat that this has been extremely valuable for them. So please, students, feel free to thank the employers as well. Employers, we would love to have you stay, but we know you're busy, and then this is the evening. And so if you would like to stay and hear Joe Riley from our Career Center talk to the students about the resources that we have here, that would be great. And if you can't, we certainly understand. With that, we'd like to turn it over to Joe from the Career Center, unless there's anything, Ben or Michael, that we missed that we needed to add.
No, I think you about covered it.
Employers, thank you. Thank you.
Thank you.
Thank you.
Thank you for having us. It's an exciting time for all of you. Best of luck.
Best of luck to you all.
Bye.
Thank you.
Again, students, please stay.
So,
And
thank you. My name is Joe Riley. I work along with Melissa, Michael, and Ben. I work for every single one of you that are students that are out there listening. My job is to help your transition from when you're graduating to finding a job, to help you with your resume, to make you feel comfortable when you are going for a job interview, to give you some strategies and some pointers on helping you find a job. And I'm just going to take just a few minutes just to kind of give you some a checklist that you can use that will help be a guide for you. But before I do that, I want to say one thing, and I mean this sincerely to every single one of you that are in our allied health programs. I just want to say thank you, because all of our discussion tonight began with the challenges that the whole healthcare system is facing regarding COVID and all of the difficulties, whether it's in a nursing home, whether it's in a hospital, whether it's in an emergency room, whether it's in an ambulance, all of the whole healthcare system is being challenged by COVID. And I want to thank you for your willingness to be part of the solution, your willingness to be part of the healing that's eventually going to resolve this like nightmare that we're all living. So thank you for being part of the healthcare answers to the difficulties and the challenges that are out there. So I want to bring up and share with you a couple of points. So this is, if I could offer you a couple of areas as far as tips regarding actions to take to help you with a plan to find a job. And the first one is this: have a plan. All of you have put together your career goal with an academic plan, whether it's getting your phlebotomy certificate, whether it's getting your RN, you had an academic plan. I want you to do the same thing. If you're thinking about a career and finding a job, you have to approach it in an organized, systematic way by having a plan. And so here's the things, and this checklist, this really can be your plan. The first thing that I would say to all of you is this: take advantage of the resources. Just like tonight, I'm so impressed by the number of students that came out tonight that wanted to hear what the employment agencies had to say, that wanted to hear what the advisors had to say. So it's all about taking advantage of the resources that are out there. Whether it's talking to your academic coach, whether it's taking advantage of talking to your faculty, your teachers, you're doing your internship. At the internship, You should be like just asking a lot of questions, talking to people, picking their brain. So take advantage of all of the resources that are available to you out there. And I'm going to talk a little bit more very shortly about some of the events that we have coming up that, like, I couldn't have given the money and paid the companies more to talk about the things that they were saying. Number one example, resume. So my checklist on here and your plan should be make sure that you update your resume. You heard directly from the employers. They said that if when they look at a resume, there's a typo in the resume or there was a misspelling in the resume, they won't even call you in for an interview. So you need to make sure and take the time as part of your job plan. Part of your plan is to make sure you take a look at your resume and then have somebody else look at it. Make sure it's updated. Have a second set of eyes. We have a resume workshop that's coming up March 25th. We're doing it jointly with the Writing Center. You should take advantage of that. You can make an individual appointment with us to also go over your resume. You can come in and be part of that resume workshop, but have a second set of eyes, take a look at your resume, because you heard how critical it is. If your resume is not accurate, is not clear, is not concise, and has it's correctly written with no spelling errors, you will not get even involved. They won't even invite you in for the interview. So make sure your resume is clear and tight and precise. Also, I would suggest working on having a personal 30-second statement about yourself. So when you come in for an interview, there's a term that I like to use. It's called own the room. So when you go in for an interview, whether it's a video interview just like this, or you're going into a room where you're going to be interviewed in person, own it. Like, go in confident, go in there believing in yourself, and have a 30-second prepared statement about who you are. So all about, like, you can say, my name is Joe Riley. I'm graduating from Dutchess this May. My major is in nursing. I've always felt the importance of being part of promoting good healthcare. I've always felt the importance of connecting with people to make sure that they understand what their healthcare options are. And I want to be part of making sure that people are living a healthy life. And if they're having any issues, I want to be able to work with them so that they understand what their options are. I want you to, and to be able to have a 30-second personal statement where you can just look in the mirror and practice it and be able to state very clearly and concisely who you are and why you're the best person for that job. Own the room when you're going in for an interview. Next thing I would suggest this, and if no matter what group I'm talking to, but especially for you who are in the healthcare field and getting a lot in whether it's phlebotomy or it's paramedic or it's being a nurse or an MLT, you should be involved in a professional organization, even while you are a student. And I've heard from more than one manager for human services that they will often look, and if they see that somebody's new, just entering the field, but they're connected to a professional organization, it gives them a message that you're interested in always being better, of always learning the job, of providing a quality service. You're somebody that's taking the extra step to connect with a professional organization. And there's a professional organization for all fields. So one thing that you can do then to improve your resume and also just make you more marketable is get connected with a professional organization. So on here now, let me move down here a little bit. And next, so we have, let me just close this out. We have a couple of events that are coming up. So there are things that you can do. Tonight was a great resource for you, but I also would say to you, as you're looking to see what's out there and connecting with potential jobs, you should be looking for job fairs. We at Dutchess in April, the week of April 12th, we'll be having a job fair, and several of the organizations that you heard tonight will also be at our job fair. It's a virtual job fair. You'll see the event posted on our website, and there'll be flyers that will be circulating around. As we get closer, you'll probably be getting emails and texts about it. So take advantage, and we have a job fair, but there'll be other job fairs out there as well. So, take advantage of any job fairs that are out there. Ethan Allen tonight was very eloquent about the opportunities that you can have regarding working with employment agencies. So quite often I've heard this misconception from various groups saying employment, well, if I go to an employment agency, well, do I have to pay for it? The job seeker does not have to pay for getting a job with an employment agency. The job seeker works with an employment agency and they can give you a variety of different options. You heard that there's hiring from just starting out, CNAs, there's all kinds of options. So an employment agency can work with you to find a potential position, and you do not have to pay. The employment agency gets paid by the employer. They have contracts with employers that cover their costs for doing the recruitment, marketing, and advertising. The actual job seeker does not have to pay. Then thirdly, I would say there are job sites that you can look up for positions, things like Indeed or LinkedIn. So there are various job sites. We have a number of them on our career page that you could look at that is also going to give you opportunities for positions that you could apply for. So, and I just want to one or two last points on here. So, and I would say to you in just 3 words: prepare, practice, and research. So prepare. Have a plan that you're going to work on as far as implementing and looking for a job. Prepare your resume. So make sure that you're preparing and making sure your resume is in good shape. Practice that 30-second personal statement so that when you go in for an interview, you're going to own the room. You're going to be able to go in there confidently and say who you are and why you're the best person for the job. And then do some research. Look up job fairs. Do some research on employment agencies, do your research on looking up individual job sites and following up with them. On our career page, I'm not going to go into it now, but if you go onto our site career page, you'll see the events that we have that are coming up. You'll see the links for some of the employment agencies. You'll see links for some of the job sites, and you'll also find out the events that we have coming up with the job fair that's going to be in April. In March and also in April, we're going to have resume workshops, so you can take advantage of that. And thirdly, when you're doing a resume, often people will look at what other things have you done? What other areas have you done anything like to help your community or make a difference in your community? So in 2 weeks, we are having a volunteer fair. So this is a fair for anyone who is interested in giving back to your community and making a difference in your community. And the agencies, the not-for-profit agencies that are looking for volunteers that day, you'll have a chance to connect with them. And things such as like Meals on Wheels, Sparrow's Nest, working with organizations, the Mental Health Association, American Foundation for Suicide Prevention. So a number of local not-for-profits who are seeking volunteers. You'll have a chance to connect with them. It's something that you can connect and add onto your resume, but it's also something that for you personally is going to make a difference in your community. So I'm going to end it with that. And I started out by saying, I work for you. I honestly do work for you. So you can reach me by contacting the ACT Center. It would be a pleasure and an honor for me to work with you on your resume and helping you prepare for finding your job when you graduate. And I look forward to working you all down the line. And if you have any questions, feel free to email me. I'll put my email contact on there. And I work with Melissa, Michael, and Ben in the ACT Center, so you can always reach me through the ACT Center as well. Thank you all very much.
Joe, I think there are questions in the chat room. And so if maybe we could look at the couple of questions. And so please, if anybody else has questions for Joe, please put them in the chat room now. And before you leave, we would like you, if some of your names are coming up on the screen, but if you could put your name in the chat room and your full name so we can email you and follow up. We have a survey that we would like to ask you to complete, a post Expo survey, and then also so you can participate in our raffle. So please put your full name in there in order to be eligible for the raffle, and so that we can send you a follow-up and any additional information. And Joe, there were a couple of questions that came through in the meantime. There was one about, do you need a cover letter with the resume?
Okay.
That one I saw.
So actually, that's a great question. And the short answer would be yes. You should have developed, have a cover letter with your resume. And when we do the workshop, the Writing Center is part of the workshop, and the Writing Center does a whole section all about the cover letter. It needs to be professional, and there are certain points that you should cover in that you should make sure is addressed in your cover letter. But the answer is yes. And I think one of the employers tonight, when they spoke about like receiving the cover letter and the importance of the cover letter is professional and well written.
And there was another question, Joe. Should the resume include non-healthcare roles?
Depends. You want to maximize the experience that you have that's relevant. But if you have little experience, or you're just starting out new, but you have a track record where you have work experience that shows that you've maintained a job, you've maybe had good customer interactions and worked with people, had maybe some supervision, or that you had a job where you were given more responsibilities, that's giving a message to the employer of a sense of being responsible. Or maybe you had a job where you had to be in a quick-paced, fast environment, so that's showing that you have good time management skills. That's a good transferable skills for nursing. So you want to accentuate the relevant skills, but there are some areas where you have good transferable skills in a job that's not direct related, and you definitely want to highlight that. You don't want to just completely ignore it or leave it out.
And I think the last question is the resume workshop in person or by appointment?
Both. So the workshop that we're having, the next workshop is March 25th. You can, it's being advertised through the Writing Center and through the ACT department. So March 25th, 12:30, there's a Zoom session that's live with both the Writing Center and myself doing it. But then separately from that, you also could meet individually. I would suggest going to the workshop first, because that will give you a good background and basis to start out with doing a draft. That way you can get a draft done. And then if you need to meet with us individually, we could take a look at your draft and give you some feedback on how to tighten it up.
Thank you. Thank you. And again, thank you, Joe. Thank you, Michael, Ben. Thank you, students, for being here. We really hope that this was helpful and informative for you. We have a lot of information. As Joe mentioned, we have a lot of workshops, career information. So please reach out to anyone in the ACT Center. We can point you to the right direction. We have a lot of resources available to you, and we want you to do well. We all have the same goal here. We want you to graduate from Dutchess in whatever program you're in and go on and get the job that you're hoping for. And we are here to help you do that. And we, again, thank you for the healthcare field that you chose. You all are or will be on the front line, and we can't thank you enough for doing that for us. And again, thank you for coming. Ben, Michael, do you have anything to add?
No, just thank you, Melissa, for your kind words, and I just thank you so much for everybody for coming. Hope it was helpful.
And for the raffle, we will choose the raffle in the probably next week, and we will notify the winner of the Panera Bread gift card right here. So one of you will be receiving this in the mail. We will let you know. We'll get your address.